In the U.S., we are still seeing a shortage of commonly prescribed antibiotics, such as amoxicillin, as well as other over-the-counter medications used to treat patients with any of the respiratory viruses slamming this country. Parents across the country are especially concerned as pharmacies run out of children's meds, such as Tylenol and Motrin, and now the FDA is saying this could last months. Joining us now, former Obama White House advisor for health policy, Dr. Zeke Emanuel. He's vice provost for global initiatives at the University of Pennsylvania and an NBC News and MSNBC medical contributor. And he's out with a new piece for the Washington Post entitled "Drug Shortages Are an Urgent National Danger. Here's how we fix them." Zeke, good to see you again. How do we fix them?
Well, we do have to reshore our production. A large part of this problem is offshoring to China and India, where production is episodic because of contamination and other quality problems. And we should never be letting our chief global rival, China, produce most of our medicines. Over 90% of our antibiotics are produced by China. We have to reshore them. And the best way to reshore them is to go back to the old days. Between 1976 and 2006, Puerto Rico was our main site of production, and we should return to that.
So, Zeke, we've been talking about this for a couple of years now. You've been talking about this for a couple of years as well, because when COVID first erupted in February, March of 2020, we were having shortages, whether it was mask shortages or ventilator shortages. But then we started talking about shortages in medicine. And here we are, what, 2 years later? 3 years later. We're still talking about it. Yeah, 3 years later. Unbelievable. When are we going to start moving on this? This seemed like a no-brainer 3 years ago.
What's the holdup?
Well, I think the good news is that there's now a bipartisan group of people in Washington, congressmen and senators, who want to move something. Their proposal, unfortunately, is mostly to try to get Medicare and Medicaid to buy preferentially to the United States. But this is a supply problem. This is where do we produce? And the fastest way to produce things is to go back to the old days. Give a tax break to production of drugs and devices in Puerto Rico, and that will increase production there. We have facilities. We have a trained workforce. It's relatively lower paid than the United States. It'll also bring Puerto Rico out of recession. So it's got lots of advantages. It's got economic advantages for Puerto Rico. It's got national security advantages, not making us beholden to China. And it's got health advantages, eliminating the generic drug shortages that we're having. And it's not expensive. So I think that's the way to go.
Dr. Emanuel, you touched on it, but I want to underline it. 97% of our antibiotics, American antibiotics, are made in China. There's a supply chain issue. There's the question of quality. There's the question of whether the FDA can get in and inspect these places even. So as a physician, on the patient side of it, what concerns you about all of this?
Well, you can't get critical antibiotics. You can't get critical things like lidocaine or a lot of infusions, those little bags that people see at the side of a bed. A lot of those are in short supply. We moved production when this tax break to Puerto Rico went away, and we moved it to the lowest cost place without thinking about contamination, without thinking about FDA inspection, without thinking about putting our health in the hands of China. That is a very silly move. For a few pennies on these pills, we have gone to China. We need to bring it back. You know, we recognize this, the importance of this in terms of chips, microchips. So we are investing a lot in bringing microchip manufacturing back to the United States. Drugs are just as important as microchips and can threaten the country if they get terminated. And so we need to just invest over there in Puerto Rico and let the drug companies begin producing there.
All right, Dr. Zeke Emanuel, thank you very much for being with us this morning. I think we'll be talking about this a lot more in the weeks and months to come.